Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Let's try to answer some MCQ in gynecology. Please choose the one best response. Let us start with the first. A 30-year-old woman was diagnosed by hysterosalpingogram as having bilateral proximal tubal blockage. Her husband has normal spermogram. What is the best management choice for this couple? Again, a 30-year-old woman was diagnosed by hysterosalpingogram as having bilateral proximal tubal blockage. Her husband has normal spermogram. What is the best management choice for this couple? A. Doing a laparoscopic opening of the tube and then expectant management. B. Doing TVS, folliculometry, and the timed intercourse. C. Doing controlled ovarian hyperstimulation. D. Doing IUI. E. Doing IVF. Choose the one best response and try to answer before me, as I always say. Think about it. Yeah, the best one response here is doing IVF. So E, doing IVF, is the best one response. Don't be confused with A, doing a laparoscopic opening of the tube and then expectant management, because here we are talking about bilateral proximal tuber plug, not distal tuber plug. So laparoscopy here has no rule. So the best one response is to do IVF, in vitro fertilization, and the embryo transfer inside the uterine cavity. Okay? Next, a 70-year-old girl presents with oligomenorrhea, hirsutism, and weight gain. Ultrasound reveals bulky ovaries. What is the most likely diagnosis in this girl? A. Endometriosis. B. Cushing syndrome. C. Polycystic ovarian syndrome. D. Ovarian cancer. E. Pelvic inflammatory disease. Please choose the one best response. The one best response here is Polycystic ovarian syndrome, because this girl has oligomenorrhea, hirsutism, which is a sign of hyperandrogenism, and weight gain, and the ultrasound show bulky ovaries, increased ovarian volume, one of the ultrasound finding in PCOS. So this is the best one response. C. Polycystic ovarian syndrome. Next, please. Which of the following is a feature of second-degree uterovaginal prolapse? Again, which of the following is a feature of second-degree uterovaginal prolapse? A. Complete protrusion of uterus outside introitus. B. Descent of genital tract within vagina. C. Descent of genital tract up to introitus. D. Descent of cervix below the ischial spine. E. Descent of genital tract outside the introitus. Please choose the one best response. And of course, try to answer before me. Here we are talking about second-degree uterovaginal prolapse, so the best one response here is E. Descent of genital tract outside the introitus. Okay, let us go to the next. Which of the following is a recognized feature of postmenopausal women? Again, which of the following is a recognized feature of postmenopausal women? A. Low FSH and LH. B. Increased bone mineral density. C. High level of estrogen. D. Increased incidence of uterine fibroid. E. High FSH. Please choose the one best response. It's easy, I think. The best one response here is high FSH. So E, high FSH, is the best one response. Okay. What would be the terminology of pelvic inflammatory disease indicate? Again, what would be the terminology of pelvic inflammatory disease indicate? A. Vaginitis. B. Porcelain gland infection. C. Infection of skin's glands. D. Endometritis and salpingo-nephritis. E. Infection of the urinary bladder. Please choose the one best response. Yeah, the best one response here is D. Endometritis and salpingo-nephritis, because we are talking here about pelvic inflammatory disease, which indicate infection in the upper genital tract. What is the upper genital tract? It is the part above the internal os, so including endometritis, salpingitis, nephritis. Okay, let us go to the next. Which of the following may increase endometrial hyperplasia incidence? Again, which of the following may increase endometrial hyperplasia incidence? A. Premature menopause. B. Delayed menarche. C. Excess estrogen exposure. D. Combined oral contraceptive pills. D. Multiparity. Please choose the one best response. The one best response here is C. Excess estrogen exposure. Yeah, can cause endometrial hyperplasia. Next, please. A 20-year-old woman present with an asymptomatic thin-walled simple ovarian cyst 5 cm in diameter detected accidentally on ultrasound scan. What is the past management for this patient? Again, a 22-year-old woman present with an asymptomatic thin-walled simple ovarian cyst 5 cm in diameter detected accidentally on ultrasound scan. What is the past management for this patient? A. Laparotomy and ovarian cystectomy. B. Follow-up by ultrasound examination. C. Laparoscopic ovarian cystectomy. D. Salpingo-nephrectomy. E. Aspiration of the cyst. Please choose the one best response. Okay, everybody? The best one response here is B. Follow-up by ultrasound examination. Because if you did a follow-up by ultrasound examination in next months or after 2 months, you may find the spontaneous resolution of this ovarian cyst because it is mostly functional cyst. So don't do invasive maneuver like laparotomy or laparoscopic ovarian cystectomy. Okay? And also aspiration of this cyst is not preferred because recollection will happen with increased incidence of infection also. So in recent guidelines, there is no rule for aspiration of the cyst. As regards the laparotomy and the laparoscopy for ovarian cystectomy is not indicated in such case because it is a functional cyst and spontaneous resolution mostly will happen. So all what you need to do follow-up for the patient by doing ultrasound examination to see if the cyst is decreasing in size or completely disappear. Okay? I hope it is clear enough. Which of the following types of vulvar cancer is the commonest? Again, which of the following types of vulvar cancer is the commonest? A. Paget's disease of the vulva. B. Squamous cell carcinoma. C. Melanoma. D. Adenocarcinoma. E. Basal cell carcinoma. Please choose the one best response. Here, the one best response is B, squamous cell carcinoma. Yeah, the commonest type. Okay, go to the next, please. Young woman, 22-year-old, present with abdominal pain, menorrhagia, and 18-week size mass arising from hypogastria. What is the most likely diagnosis in this woman? Again, young woman, 22-year-old, present with abdominal pain, menorrhagia, and 18 weeks size mass arising from hypogastria. What is the most likely diagnosis in this woman? A, endometriosis, B, fibroid uterus, C, pelvic inflammatory disease, D, ovarian cyst, E, mesenteric cyst. Please choose the one best response. Okay, the one best response here is B, fibroid uterus. Pelvic abdominal mass and heavy menstruation or menorrhagia. All of them are signs and symptoms of fibroid uterus. Go to the next, please. A 64-year-old woman presents with abdominal mass and weight loss, was diagnosed as having an ovarian tumor. What would be the most common ovarian tumor in this woman? Again, a 64 years old woman present with abdominal mass and weight loss, was diagnosed as having ovarian tumor. What would be the most common ovarian tumor in this woman? A, germ cell tumor, B, epithelial tumor, C, stromal tumor, D, sex cord tumor, E, trophoblastic tumor. Please choose the one best response. The one best response here is B, epithelial tumor, because this epithelial tumor is the commonest, and also it is more commonly in older age, so 64 years old, and epithelial tumor is the commonest ovarian tumor, so this would be the best one response. This is the last question. I hope it was interesting and clear enough. This is my 3 scientific site, one on Amazon for my books, published on Amazon, textbook of Obstetrics, textbook Gynecology, contraception handbook, multiple choice question book where you can find many questions in multiple choice question in Obstetrics, Gynecology, and contraception. Also, I have medical disorder in pregnancy book and the gynecologic oncology book. All of them published on Amazon. You can find the Kindle edition or the hard copy, and you can also see sample of this book. This is the other link in blue here. Is my site on YouTube channel where you can find more quizzes like that, more lectures in OOP guidelines, case scenario discussion, and so on. The last one is the blogspot.com site, my site here, containing some picture of my operations and some articles. Okay, everybody, my best wishes for all of you.